better. Do you mind if I have you stand there and I just make a slight adjustment?
Yeah, that's fine.
Just look straight ahead.
Appreciate it.
I'm better, a little taller than
I
you.
just want to make sure this is.
Yeah, that's the only problem.
Right. Yeah, I'm working the parents there.
Just make sure everybody. That'll look a little nicer.
Good to go?
Yeah.
Okay.
Thank you, guys.
It's making me really nervous.
It's okay, it's not mine.
Yeah. But you still got a file. Good, how are you?
Good, thanks. No, Chris Simpson?
Who?
Chris Simpson?
I don't even know who it is.
He's just recently promoted sergeant, he's got the castle honor.
Okay.
His parents live next door.
Oh, okay, cool.
Good guy. His kids always love playing with my dog over the
Yeah.
fence. Last month I came down and did a story with the canine dogs.
Oh, okay.
That was fun.
Welcome, everybody. And I want to give an update on where we're at. COVID numbers and hospitalizations continue to decrease modestly. We currently have about 1,547 of our fellow Coloradans hospitalized with COVID. Of those, we estimate that about 1,000 are hospitalized from COVID. The other 500 or so in that figure would be people who are hospitalized for another reason and might also test positive for COVID. That number decreased 34 from yesterday, including a decrease of 1 in pediatric hospitalizations. Majority of the people hospitalized, about 2/3 of them, continue to be unvaccinated. And again, to put that in perspective, that 2/3 of the hospitalizations are from the about 15-16% of people adults who have not been vaccinated. So that's a relatively small number of folks who remain unvaccinated are still about 2/3 of the hospitalizations for COVID. I'm also proud to say that in our first week of our free medical grade mask program, where every Coloradan can pick up 5 medical grade masks like this. We have a few different models, but similar to this model, we've distributed more than 1.7 million medical masks to several hundred locations across the state, community centers, libraries. You can check out covid19.colorado.gov/free masks to find out where you can pick up your medical grade masks. They're available in areas across our state. And it shows that many Coloradans want to protect themselves with the additional protection that a medical grade mask provide. More protection than not wearing a mask, more protection than a cloth mask, and particularly for those who are going around indoor areas with others. If you want to avoid the virus during this period of high transmission, a medical grade mask is a very effective way to do that. Now for an update on the Marshall Fire. It's been almost a month, if we can believe it, since that brutal half a day when flames ripped through Louisville, Superior, unincorporated Boulder County, destroying over 1,000 homes. FEMA has now approved over $820,000 in individual assistance. But the more important program is, and I've referenced this before, is the SBA loan program, where if you lost your home, you can borrow at 1.8% interest, 30 years terms, up to $200,000. So we've had about 299 home loans already approved. So that's almost 1/3 of the total number of homes lost have already got their SBA home loans approved. That's more than $51 million. SBA also makes business loans available. We've had 8 Colorado businesses access those loans for a total of $1.2 million. Our team at the Division of Homeland Security and Emergency Management continues to work and advocate with FEMA, with the SBA, on debris management, including with the county, on disaster unemployment. That's for folks who would have been going into work in a place of work that's destroyed and they can no longer go in. They qualify for disaster unemployment. Disaster legal services and DSNAP. I spoke with Boulder Valley School District Superintendent Rob Anderson today. We discussed what else the state can do to support students and families who've been displaced. All the schools are in session. I complimented him on being able to retain that sense of normalcy for families in the area. Currently, many families who lost their homes, some of them still have their kids out of school. Others have some distance to travel for their kids to be able to go back to have that sense of normalcy at their neighborhood school. Survivors can learn more about resources at disasterassistance.gov, and you can also visit the Disaster Assistance Center, www.boco.org/Marshall to learn about all of that. And if you are a Coloradan who wants to help, we are working with the Boulder Community Foundation to do so. There are many different gaps in SBA, FEMA, county response, and those are filled through your goodwill, through philanthropy. And I encourage you to visit www.coloradoresponds.org/wildfires. If you'd like to provide some additional help, you can also donate at www.comfound.org for the Boulder Community Foundation. It's really our resilience and our strength as Coloradans that keeps us going during these difficult times. As we manage through the COVID crisis across our country, hopefully with hospital levels continuing to decrease as we come together in support of those who lost their homes and whose homes were damaged, as well as the communities that were inexorably changed and devastated by the Marshall fires. In the next few weeks and months, we look forward to working with our colleagues on both sides of the aisle to save people money, relieve cost pressure, make Colorado more affordable in every way we can. And with that, we're happy to take some questions. Mm-hmm.
Governor, are there any specific policy proposals you'd like to see lawmakers work on in the coming months, specific to the Marshall fire? You know, they got the Firehawk helicopter last session, still being built. You know, investments in fire departments. I've heard some lawmakers talk about land use policy, building codes. I mean, what specifically do you think lawmakers should pursue?
Yeah, we would encourage and welcome discussion of all the above. Meaning, you mentioned additional resources to fight fires. Yes. Climate resiliency resources, looking at where the emerging threats are, best practices in perimeter defense for subdevelopments for homes and how that can be supported. Specifically, happy to work with lawmakers around help for homeowners that are rebuilding to make it faster and more robust and more resilient. So all of the areas you mentioned, we'll look forward to discussing with lawmakers.
And if I can follow up on that, Governor, you know, there have been reports of fears, founded ones, of really high prices for renters that do exist in Boulder County. So, you know, for those who can't afford to wait and rebuild, that's going to be some ways away. In this near term, what policies specifically would you like to see? Like, I remember earlier in COVID, you talked about relaxing occupancy limits.
Yeah.
Is that something you'd like? Any other zoning changes that either you'd encourage at the local level in Boulder County or that you personally will try to compel?
And I think I saw that the Boulder City Council did something in that realm, didn't they, around occupancy limits? I'd have to look for the Marshall fire victims. So yes, all of the above. First, we want to make it as easy as possible to rebuild, and there are many people that, with their homeowners insurance, have temporary lodging assistance already. There are others that were renters, and there are others that don't. People need a place to live. There is generally not that quantity of housing available in East Boulder County. There's not simply 1,000 places to rent, even if you had the money, which means that people are spreading out further, which also means there's additional complexities around getting your kids to school, if you want your kids to remain in the same school, getting to your jobs. So we want to support families every way we can during this difficult period, remove barriers to rebuilding, and of course encourage communities to waive occupancy limits or other restrictions that would prevent Marshall fire victims from being able to legally reside close to where they work and close to where their kids go to school.
Governor, in California, there's been issues with insuring homes that are, you know, wildfire-prone areas. Obviously, there's been battles between the legislature and insurance companies. Are you concerned about that happening in Colorado? And is there any move toward creating, you know, a state-run insurance program for homes that are in wildfire-prone?
I mean, wherever the risk resides, whoever owns the risk, whether it's an insurer or the state, homeowners are paying for it. So I think our efforts should align around reducing risk, which means practices around subdevelopment, risk reduction, defense perimeters around subdevelopments, construction materials in homes for fire resiliency. These are the kinds of things that can reduce insurance costs. It's not really about who carries the insurance. It's really about risk. And one way or the other, homeowners are paying for it. So the ways that we can reduce risk, reduce the cost of owning a home, reduce fire risk, that's something that really is exciting to us and that we hope to work with communities to do.
Shifting gears a bit, there's been a lot of demand for COVID rapid tests in recent weeks. I'm wondering where the state stockpile is on that. What is the state's inventory look like? Has it
Yeah.
drawn down dramatically?
We are now down to about a week turnaround. If you request a at-home Binax test today, you will get it in about a week. It had been 2.5 weeks during the peak demand period. Before that, it had been less than a week. We, as I've indicated, once we're confident that the federal at-home instant test delivery program works well, we plan to roll ours into theirs and discontinue it as a state. But we haven't seen that yet. We want to make sure that that is reliable, that people can get to test for free. But in the meantime, they can request them either from the state or federal government, and ours are being delivered. We have two different brands. You don't get to pick the brand, but we have the iHealth ones that we pick because we weren't getting enough Binax and Binax, and we are turning those around in about a week.
How many are on hand?
We'll be happy to get back to you with those numbers. It's more of a weekly number that we get, and then they pretty much all go out that week. So it's that's the way it works. But we have those inventory numbers in real time. But like we're not sitting on them. They come every week and they go out every week. Yeah. Any other questions?
Governor, you told us that you're opposed to the current draft of the bill that would allow local government employees to unionize. Can you talk about what your opposition is, and if there's any way that the bill that would be something that you could approve?
Well, we don't negotiate that through the press, but we are in conversations with local governments, with workers and others to see what a path forward might look like.
If you can speak generally, is the concern that it's too broad? I mean, they're talking about all public sector workers. Does this need to be broken up into chunks?
Well, so again, we as much as you might like, we just don't negotiate through the press, but we are in talks with both trying to bring together local government and workers representatives around a solution that would work for Colorado. Yes, do you have last one?
And yeah, kind of jumping on that, now that the King Super strike
Yeah.
is settled, your thoughts on that, how that might in the future?
Yeah, first, congratulations to UFCW, to the workers, and of course to the company. Coloradans are very excited to be able to shop at King Supers and not have to worry about crossing a picket line or not have to worry about not having service there. It's a major chain in Colorado, and we're thrilled that they're doing better by their workers. Thank you, everybody.